Hi, I'm Dr. Neil Beck. I was a doctor in Perth, Australia for 53 years. We originally didn't have a medical school here, so there was a shortage of doctors. Every doctor had to have come from somewhere else in the world, or to have gone somewhere else in the world to train to be a doctor. So we were very busy, and we did a lot of things that family doctors don't do now. My first 2 years was working in the hospital, then many years as a family doctor, and then 5 years. For 5 years I had my own addiction clinic, and altogether helped to bring 800 babies into the world, did many tonsillectomies and appendicectomies and broken bones and all sorts of things, had 500,000 consultations and home and hospital visits, and saw almost every kind of person with almost every kind of problem. I was particularly interested to know what were the most important things for people to have a good life, because as a doctor I was seeing people who were having problems, and we wanted to help them to have a good life. I'd like to tell you some of my conclusions. To get a good life, the two most important things are to be mentally healthy and to have enough good relationships. And to improve your mental health and improve your relationships, the three most helpful things are: one, an app that can help you find and give you a list of all your main mental and social problems in descending order of importance in 2 or 3 minutes, with links to 6 under-a-minute videos that will help you most. So I developed the Mental Fix-It app. The second most helpful thing is 6 under-a-minute videos for your particular mental and social problems. Those 6 videos are the fastest, easiest, most convenient and best way for you to understand and start getting your problems fixed. And you can watch those videos as often as you need and at any time and anywhere until you understand it all. And the third most helpful thing is learning to make new good habits and break old unhelpful habits, because most mental and social problems are caused by old unhelpful habits, or by the lack of a need for a particular new habit. Habits make up 60 to 65% of our life, and if we've got bad habits, we're going to have a bad life. And the more good habits we have and the less bad habits we have, the better our life will be. And what I found was that there was far more mental health problems than there were people, mental health workers. There were never going to be enough mental health workers to help all the people with mental health problems who needed help. So a lot of people suffered for lack of help, and a very big problem was that there were waiting lists everywhere, and while people were waiting for help, they got much worse. And the worse they got, when they finally got help, the more help they needed. And as a result, most people, lots of people didn't get any help or very little help. Almost nobody, as far as I could see, got enough help. And the situation was just getting worse. So what was the solution for all that? What were the weaknesses in the system? I found that there were many serious blind spots in mental health. We were treating people's distress but not looking for and fixing the causes. And when they still had the cause of their mental health disorders, it was much harder to help them. And even if you did help them to get better, they were much more likely to relapse if they still had the cause. And we treated people as individuals when they were not individuals. Nearly all mental health problems were family mental health problems, and they needed to be treated as family mental health problems. But we saw people one at a time and treated them as if they had a separate problem. And a great problem was that nobody seemed to realize the importance of what's now called transgeneration trauma. That is trauma going from people to their children, to their grandchildren, to their great-grandchildren. It's very important to know what the most distressing things were that happened to your parents, your mother and father, and to their mothers and fathers, and to their mothers and fathers' mothers and fathers, because those very distressing things tended to cause trouble for generation after generation. In my family, 4 premature deaths in 3 generations caused many, many problems. And I never understood that until quite recently. There are other blind spots in mental health which must be overcome, like particularly the need for dealing with problems as soon as they start. We tended to not deal with problems until they got very bad, and when people were desperate and couldn't keep going, then we'd try to fix them, and it was so much more work to try to fix problems late, when problems had caused more problems that had caused more problems that got more and more complicated. And another great problem was that the mental health tools were weak. We do most things with tools. Tools help us to do things better, quicker, easier, at a lower cost. But there were only 2 mental health and addiction tools, and they both had big weaknesses. One was medicines, and medicines had 2 big weaknesses. One was that so many of them were addictive. You don't want addictive medicines, but virtually all the medicines for the commonest problems, which were worry, anxiety, and for the common problem of sleep disorders were addictive. Originally barbiturates and then benzodiazepines, Valium, Seropax, Mogadon, Xanax, and Ambien and Silnox, all addictive. And the three main stimulant medicines for ADD were addictive. That's Ritalin, dexamphetamine, and Adderall. And that caused so many problems. And the other weakness of medicines is they're too slow. When you're dealing with mental health and addiction issues, you need medicines that work very quickly. But when you take a tablet or swallow a capsule, it takes half an hour to an hour to go right down your gut and start to be absorbed and start to work, and 1 to 2 hours to work strongly. And that's just too slow. And the other tool, which was counseling or talk therapy or psychotherapy or CBT, whatever you like to call it, had two weaknesses. Its two weaknesses were, one, that it was very slow. When I saw a new patient with serious mental health problems, I needed an hour to talk to them about when and how it started, what probably caused it, what makes it worse, what's keeping it going, and how it's affected by other members of the family, and where and how it can best be helped. The first consultation needed to be an hour, and then you needed to see them every week for weeks and weeks or months and months for half an hour and 3/4 of an hour or an hour. Just too slow. And secondly, too expensive. To be a therapist, you needed at least a 4-year Bachelor of Psychology degree from a university. And a lot of psychologists had a 6 or 7-year PhD degree. And psychiatrists all needed to have a 6-year general medical training, followed by 2 or 3 years at least of general medical practice, and then 3, 4, or 5 years of postgraduate training in psychiatry. So all those people were very intelligent. They were graduates of universities with somewhere between 4 and 10 years training, and they needed to be paid well. They deserved to be paid well, and if we didn't pay them well, we'd be even shorter of them than we are. So talk therapy, too slow and too costly. Troubled people usually couldn't afford them. The more troubled they were, the less likely they could afford to pay for expert help. If they had health insurance, the number of sessions they could have with the psychologist was limited each year to a number that wasn't enough. And governments couldn't afford to pay for all the consultations that people who couldn't pay themselves needed. So the mental health and addiction clinics were inadequate and had long waiting lists. So what's the solution to all that? Over a 27-year period, I focused on this problem, and the solutions that I came up with that I believe would solve the problems are, first of all, a complete package of very effective tools, not just 2 tools with big faults, but 7 or 8 tools which were very effective in different ways. And secondly, there had to be self-help. When you can't get enough help, you need to help yourself. And a lot of people with good, effective tools could help themselves. Some of them could do half of what needed to be done with self-help and tools. Some could do 3/4 of what needed to be done. Some could only do 1/4 of what needed to be done, and some were not able to help themselves very much at all. But if self-help with a complete pack of tools could do half the work, the mental health and addiction work that needed to be done, then there would be enough mental health and addiction professionals to do the rest of the work without waiting lists and without discharging people from treatment before they were properly better. So, tools, self-help, and starting early. It was so important to start mental health care early. When mental health problems first arise, they're often not that complicated and not that severe, but they tended not to be dealt with until they were complicated and severe, for 2 reasons. One is that there were waiting lists. People had to wait a long time before they could be seen. And in that time they were waiting, things got worse, got more complicated, got more ingrained. And also the other reason why things weren't got early was that there was a stigma associated with mental health and addiction problems. People, we looked down on people with those problems as though they were weak and stupid and irresponsible. So they didn't want to ask for help early, because that would mean they'd be admitting they had problems, and they'd be thought to be stupid, negligent, or whatever. When in actual fact, most problems started in childhood, when children didn't have the ability to cope with problems, or they happened as a result of accidents or incidents that people weren't to blame for. So the stigma was mostly unfounded, but it caused delays in people seeking treatment. The conclusion I came to in the end was that not just some people had mental health issues, almost everybody had mental health issues. And why was that? That's because our mental health is formed when we're still in our mum's tummy and in the first 1, 2, or 3 years after we're born. And there are no perfect mothers, and there are no perfect fathers, and there are no perfect grandparents, and there are no perfect families, or perfect homes, or perfect neighbourhoods, or perfect schools. So nearly all children suffer in childhood at some stage or another. Some suffer terribly, of course, terribly. But nearly everybody suffers, and that bends and twists them a bit. Some only a bit and some a lot, but I believe the world would be a much better place if we assumed that everyone had problems in early childhood, and we assessed and helped everyone as early as possible before the problems created more problems and got more and more deeply ingrained. So what were the common mental health problems? There are about 8 or 9 of them. According to the DSM-5, which is the psychiatrist and psychologist Bible, there are about 500 mental health and addiction issues. But I found that if I learned to deal with about 8 or 9 of them, I could help most people a great deal. Not that my training was very good. As a medical student, my training in mental health was 8 one-hour lectures from a psychiatrist and 2 visits to mental hospitals. And I can tell you, that doesn't tell you all that you need to know. But family doctors learn a lot because so many people depend on them for their mental health care. 38% of family doctor consultations now are mental health consultations. I think probably the younger generations of doctors get much more mental health training as medical students than what I and my generation got. But anyway, family doctors learn because they have these troubled people coming to them every day. 38% of their patients, mental health and addiction troubled people, and they learn. You have to learn. You make mistakes, but you gradually learn. And what I learned was that the main 8 or 9 problems were worry, anxiety problems, that is general anxiety, social anxiety, panic attacks, obsessive compulsive disorder, phobias, then sleep disorders. Sleep disorders were common. Then major depression, then bipolar disorder, which is swinging from highs to lows, then ADD, ADHD, then post-traumatic stress disorder, which was severe distress episodes following having had or having witnessed life-threatening severe traumas. And then there were a couple of things that didn't seem to have names, so I gave them names. One I called IAD, that's irritability anger disorder, because there was a lot of irritability, anger and violence. There was a great deal of domestic violence, with, in Australia, 1 woman being killed every 4 days on average by her partner or ex-partner. So irritability, anger, violence, rage, IAD was a common problem. Another problem I called PTEF, post-traumatic evil focus. That was when people had such a terrible problem happen to them that they couldn't cope with it, so they diverted their attention to other people's problems on the other side of the world, like the CIA or Guantanamo Bay, or terrible things that were being done to women and children in some faraway place. And then, of course, there was schizophrenia and there was autism. And what I found was that people who had one serious mental health problem almost always had 2, 3 or 4 other problems, some quite big and some smaller, but all problems that made things worse. But sadly, most people and a lot of doctors just assumed that people had one problem when they really had 2, 3, 4 or 5 mental health problems. And I think that was because our bodies are pretty big, and when we've got a problem in our foot, we usually don't have a problem in our head, and when we've got a problem in our chest, we usually don't have a problem in our leg. But when we have a problem with this part of our brain, that part of our brain and that part of our brain are pretty close, and they're usually affected as well. So people with serious worry, anxiety problems often had major depression and sleep problems, and people with major depression often got anxiety and sleep problems, and people with ADD, ADHD often had anxiety and depression problems, and about a quarter of them, in my experience, they got their ADD, ADHD in early childhood, and somewhere in their late teens or 20s, they also developed bipolar disorder, which often wasn't recognized, and people would say, my ADD, ADHD medicines aren't working anymore, when the real problem was that they'd got another problem, bipolar disorder, which needed different treatment, which they weren't getting because they, and often their doctors, thought they only had one problem, which was the ADD, ADHD. So, multiple problems. So over the years, over 27 years, I developed a package of 7 tools, with 2 or 3 or 4 more coming. One of the earliest tools was videos. I was explaining the same thing to 10 or 15 or 20 people a day, and that took so much time that making a video about the problem, which they could watch either in our waiting room or at home as many times as they needed to, whenever they needed to, and that was a great step forward. But the original videos about 12 or 14 years ago were 7 to 15 minutes, and gradually over the years people stopped watching 7 to 15 minute videos, and they all wanted TikTok type videos, under a minute videos. So eventually, instead of having 9, then 31 7 to 12 minute videos, I had to develop nearly 100 under a minute videos. I had to have that many because each under a minute videos can only deal with one area, and there are a lot of areas, so you need a lot of videos, and that gave rise to a need for the next tool, which was websites where people could read things. And so I had a website called mentalhealthvideos.com, and that was pretty long and pretty detailed, and a lot of people wanted something much shorter. So now I've got a second website called smilefixit.com, smilefixit.com. And on smilefixit.com, everything on one page and with links, and you can just tap the links to the things that you need more detail about. And the next thing was an app. It started with a checklist because we had to ask everybody the same questions over and over again, and that took a lot of time, and so I developed a 20-question checklist which one of my assistants did with new patients that saved me a lot of time. But eventually we realized that an app would be a lot better than a checklist. With an app, people could do it on their own, and they could do it on their phone at home, and they could do it as often as they needed to, whenever it was convenient, whereas the checklists had to be done in my offices and with the help of a staff member. So we developed the Mental Fix-It app. And the Mental Fix-It app had 38 questions, and each question had 3 possible answers, and you just tapped the answer, one of those 3 answers that was closest to being right for you. No, not a problem. Yes, a moderate problem. Yes, a severe problem. And people could go through those 38 questions in about tapping answers in about 10 minutes, and then the app gave an instant report on everything that they'd tapped. 10 minutes was longer than what a lot of people were prepared to do. They just didn't do it. We got hundreds of people doing the app, and we wanted to have thousands and thousands of people doing the app. So we cut it from 38 questions to 19 questions, which they could do in 5 minutes. And that was more popular, and it still covered the most important things. But now we're working on a new way of asking the questions that will allow people to do the app in 2 minutes. In 2 minutes they can go tap, 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 and at the end of that they get an instant report on their phone which lists their problems in descending order of importance, all of them, which is very important. If you want to get completely better, you want to know everything that needs to be fixed. And with slow talk therapy, people so often never got past the first and second big problem, and the little problems, which were still important, never got really noticed or attended to. But the Mental Fix-It app, the 5-minute version now, and soon the 2-minute version, would find all the main problems in a very short time and give an instant on-screen report. My goal is for a troubled person to be able to take their phone out, tap the App Store or Google Play icon, download the Mental Fix-It app in a few seconds, answer the questions or tap their choice of answers or their choice of scores to each question in 2 or 3 minutes. And the instant report already now tells them 4 things, but the 2-minute report will still tell them those 4 things. Those 4 things are the 6 of our 100-minute videos that will help their particular problems most, because different people have different problems, and they can't go through 100 videos, 1-minute videos, to find which one's best for them, but the app tells them which 6 of our 100 videos would help them most. Secondly, it tells them which medicines are likely to help them most, and then they can do some research and some thinking, but of course they'll have to get a prescription from a doctor to get the medicines. And the third thing that the Instant App Report gives them is a complete list of all their problems, 4, 6, 8 or 10 in descending order of importance, each with a score, because everything they press as a problem has got a score. The score depends on how important that thing is. For instance, serious post-traumatic stress disorder gets a high score, about 15, but mild or moderate sleep disorder or anxiety disorder gets a low score, maybe 4 or 5. So their instant report tells them what all their problems are in descending order of importance with a score for each. And the fourth thing the instant report tells them is their total score for that day, and puts it in a graph of all their total scores. So each time they do the check, and we encourage them to do it often, because every time you do it and you read a question and you think about what's your answer, you understand that question and you understand yourself a little bit better. It gets clearer and clearer and clearer. So if you've got 6 problems and they've each got a score, then the app adds those scores together for that day as a total score for that day, and then it puts it in a graph of all your total scores. So if you've done the app 10 times, that graph has got 10 total scores, and you can see whether you're getting better or not. And you sort of know whether you're getting better or not, but this is more exact. It's very helpful with regard to your treatment to know whether it's working or not. You want to know whether the treatment is working, and if your score is getting better, it is working. If it's only getting better slowly, maybe the treatment can be improved. If it's not getting better, or it's getting worse, the treatment is not working. You have to revise the treatment. And that total score graph also helps you understand things that you do and that happen in your life. If you do something, you read a book, or you go to a lecture, or you do a course, or you have some counselling, and your score gets better, you know that that thing was good for you. If you go fishing with your mates and get drunk 3 times every night for 3 days, and your score gets a lot worse, you know that's something you should avoid. So feedback on your total score is really important in knowing which things in your life are helpful and which things in your life are unhelpful, and whether treatments are working or not. Well, yeah, so we're talking tools, videos, websites, checklist, and the app, the Mental Fix It app, and then live streaming, which is what we're doing now. I do about 5 hours live streaming a week because lots of people find watching live streaming is the most helpful thing for them. We know from the number of people that watch, the number of followers and likes, that this is helpful. And we know that sometimes the session was more helpful than other times, which gives us feedback. So we do about an hour to an hour and a quarter live streaming at 7 p.m. Perth time on Wednesday, Friday and Saturday evenings, and 9 a.m. Sunday mornings, and that's 9 p.m. Sydney and Melbourne time, but sadly it's 7 a.m. New York time and 4 a.m. Los Angeles time and something like that in London. So that's why I switched the Sunday session from 7 p.m. Perth time to 9 a.m. Perth time, which gets to the Northern Hemisphere at a more user-friendly time. And I'm very interested to know what your comments, questions and criticisms are. When I still had an office and a practice and saw people face to face, that had advantages, but doing things online has other advantages, and it has the disadvantage that I don't have the personal contact. But I'm very interested to know what your thoughts are, what your comments are, what your questions are, what your criticisms are, how we could do things better. So please send us that information through the platform that you watch the live streaming on, or send it through our email address. Our email address is healthestuff@gmail.com, spelt how it sounds, healthestuff@gmail.com, but you can find it at smilefixit.com. Send us your comments, your questions, and your criticisms that way. Every evening after I do the live streaming, and again the next morning, I go through all those comments, questions, criticisms, and the likes and the new followers, and try to communicate with as many as possible. So please do that. That's 4 tools. The 5th tool is powder medicine. And why powder medicine? Because if you drop powder medicine on your tongue and suck it, don't swallow it, it gets into your bloodstream in 5 minutes and starts to help you in 5 minutes. So it's so much faster. Your tongue is pink or red because the blood vessels are so close to the surface, and if you sprinkle thousands of tiny grains of medicine on your tongue and suck it, don't swallow it, it gets into the blood vessels in 5 minutes and starts flowing to your brain or to wherever it's needed and helping you in 5 minutes, and is helping you strongly in 10 to 15 minutes. So that's so much faster and so much better for many mental health and addiction situations, distresses and cravings. And it's better than that because the powder medicines taste nice, and soon your body puts the nice taste, connects the nice taste with feeling better 5 minutes later, and then you start to get a placebo effect. As soon as you drop the powder on your tongue and it reaches the taste buds at the back of your tongue, it starts to work then, even before it's absorbed. It's a placebo effect, which is a real effect. It's not an imaginary effect, it's a real effect. And so you then start to get relief from mental distresses and relief from addiction craving as soon as you drop the powder on your tongue. And powder has other advantages. Tablets and capsules cost about twice as much as powder, because medicines, nearly all start as bulk powder, which once that's out of patent is not very expensive. But turning it into tablets and capsules, getting the right amount of medicine in each one, and tablets that don't crumble, or tablets you can break in halves or quarters, that costs as much as making the powder. So powder is cheaper, and powder is more flexible. Everybody needs a different best amount of medicine in each dose. It depends very much on your weight. If you weigh 140 kilos, you're going to need much more than if you weigh 40 kilos or 50 kilos or 80 kilos or 100 kilos. So your weight is important. How your gut absorption rate is important. Your metabolic rate, how fast you burn medicines and other things, is important. Your excretion rate is important, because once the medicine gets into your bloodstream and is flowing through your liver and through your kidneys, and your liver starts to break it down and excrete it through your gallbladder, and your kidneys start to excrete it. So with tablets, even if they come in 2 or 3 different strengths, and even if you can break them in halves, it's hard to get the right amount for you. It's hard to know what the right amount is for you, and it's hard to get it. With capsules, it's even harder. So with powder, we developed pocket powder medicine dispensers, so you can carry the powder around in your pocket, and wherever you are and whatever you're doing, if you suddenly need relief from a mental health distress or a craving, you whiz it out and you drop your powder on your tongue. And the first dispenser that we give you, the powder is very weak. So you don't take 1 dose, you take 3 or 4 or 5 or 6 doses until you find what works best for you. If you don't take enough, it doesn't work very well. If you take too much, you get side effects. When you find the best amount for you, it's got the best effect with the least side effects. And then you come back and tell us, okay, 4 or 5 or 6 doses is the best for me. So then we can give you a mixture that gives you that amount in 1 dose, which is cheaper and more convenient. So powder has flexibility of dose, and then with powder you can mix 2, 3 or 4 powders together to get multiple effects, which so many people need, because as I've mentioned, they don't just have one problem. They nearly all have multiple problems, and so one medicine will probably only fix 1 or maybe 2 problems. But if I can put 2 or 3 or 4 different powder medicines in one powder, in one dispenser, they can take it all at once. Now that's not exact. You might get a bit too much of one medicine, not enough of the other, but it's much better than than just taking one medicine, or than just trying to do it with 3 different tablets. People 3 different tablets is 3 different prescriptions, which cost a lot of money, and people get the tablets mixed up. And we find that being able to put 2, 3 or 4 powder medicines in one powder in one dispenser works much better. So, videos, websites, the Mental Fix It app, live streaming, powder medicine, powder dispensers, and heartbeat meditation aids. Meditation is so valuable for people with mental health and addiction problems. It helps them to relax, to feel calmer, to get refreshed, to be stronger, and it helps their brain adjust. We can't change which genes we've got, but what matters is which of our genes are switched off and which are switched on, because not all your genes are switched on. A lot of them are switched off. And what really matters is which genes are switched on and which are switched off. And meditation is one way of gradually altering and improving which genes are switched on and switched off. That's called epigenetics. So in meditation you focus on something, and while you're focusing on it you stop thinking about all your troubles. So what do you focus on? Well, the people that teach meditation usually teach you to keep repeating a word. Mumbo, 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 mumbo. Or they tell you to focus on your breathing. Breathe in, breathe out, breathe in, breathe out. And you focus on those things and stop thinking about everything else. Except that those two things are not very mind-grabbing. So someone who's very distressed, very disturbed, may have difficulty in staying focused and in stopping thinking about all the other things. Because our mind wanders, but we keep on bringing it back, and if something's mind-grabbing, we stay focused longer, which means our break from our problems is longer. So I've been listening to people's hearts for 50 years with stethoscopes, and your heartbeat with a good stethoscope, the sound is loud and clear and interesting and mind-grabbing. And I thought, wow, what say I get a stethoscope, cut it short, and then people can listen to their own hearts. You plug the earplugs in. This is the hearing part. You put the hearing part down under your clothes, right on the skin in your upper left chest, overlying your heart, and you listen to your heart beating loudly and strongly, and that's pretty mind-grabbing. So you can learn to meditate much quicker with a heartbeat meditation aid. And once you've been doing that for a month or two, you can gradually take over with focusing on your breathing. And in the end, focusing on your breathing is the best thing, because breathing is very closely related to emotions and feelings and so on. When you get a shock, you gasp and you might hold your breath, or some people hyperventilate, breathe too much. And just before you go to sleep, if you notice, just before you go to sleep, your breathing gets very even, very steady. So steady, even breathing is important. And so you graduate from a heartbeat meditation aid, which you only need to do if you aren't able to learn to meditate by concentrating on your breathing or a word. And then people who've been meditated for a long time can do it like that. And if they've just got 2 minutes somewhere waiting, they can meditate, or a lot of them usually meditate for 15, 20 or 30 minutes. and find that wonderfully beneficial. Yeah, so we've got a couple of new tools on the way. One is a larger pocket powder dispenser, which, sorry, got that upside down, which we put fruit powder in, and people can carry it in their pocket, and it can help them to control what they put in their mouth. Well, it can help them to do things. It can give them pleasure, and that can help them to make and break habits, and it can help them to control what they put in their mouth, because the two major epidemics worldwide that I watched developing over 53 years were mental health and addiction problem, and the diabetes, obesity, and blocked artery problem. We have far too many calories now. One of my grandfathers was a blacksmith, and the other was a farmer, and they worked long, hard, physical work, 50 or 60 hours a week. And now we sit at a desk and earn our living in 38 or 40 or 45 hours. They needed 3,000 to 4,000 calories. We need 1,500 or 2,000 calories. And not only has the need for the number of calories gone down a lot in the last 50 to 100 years, the number of calories that's available has gone way up, because food is so much more available now to everyone, but particularly sugar is a problem. 300 years ago, sugar was a rare luxury. People loved its taste, but only the rich people could afford it. And then they started to mass produce it. They started to crush sugar cane and sugar beet and make sugar, and sugar got more and more plentiful and cheaper, till now you can go to a supermarket and see a big bag of sugar for quite a low price. So sugar became a gold mine for food and drink manufacturers. It was cheap. It didn't cost them much to put a lot of sugar in things. And it sold more because people loved the taste. And it's addictive. Sugar is as addictive as cocaine. If you don't believe that, do a ChatGPT search on it. It's addictive. So cheap, very tasty, addictive sugar become a bigger and bigger part of our life in confectionery, ice cream, cakes, biscuits, and fizzy drinks. So that increase in the number of calories taken and decrease in the number of calories burnt meant the blood sugar levels rise very high and cause diabetes, and a lot of the sugar is then turned into fat, which causes obesity, and the combination of sugar and fat tends to thicken the walls of the arteries and narrow the flow, so less blood can get through, and eventually arteries can get blocked, and that can cause heart attacks and strokes, poor vision, and even some cases of dementia due to poor blood flows in the eye and poor blood flows in the brain. I got a couple more tools, but I'm not ready to talk about them yet. But that's what we needed. We need very effective, non-addictive tools that people can do self-help, and that they can start as early as possible and do whenever it's convenient and suits them, anytime, anywhere. Yeah. So please send me your comments, questions, criticisms. And today is Wednesday, so I'll be back again Friday, 7 p.m. Perth time.